There we go. We are here for Pediatric Mental Health Care Access Program and School-Based Health Center Collaboration, Lessons from the Field. All righty. So the School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. We support the improvement of students' health via school-based health care by supporting and creating community and school partnerships. Our focus is the same as yours. We support high-quality health that includes mental health care for the nation's most vulnerable children. We do this through policy, standards, data, and training. And with that, we will turn to introductions. All righty. As we get started, please introduce yourself in the chat. So if you could, please introduce your name, professional role, name of your organization, name of your PMHCA program, if applicable, as well as where you're tuning in from today, your state, territory, or tribal nation. So please go ahead and enter that in the chat as we present today's presenters as well as teams. So we do have a PMHCA initiative team that I'll briefly introduce. My name is Michaela Ribbon. I use she, her pronouns. I am a program associate here at the School-Based Health Alliance. And we also have Katie Stinchfield, who's a consultant, as well as the wonderful Laura Hurwitz, who is the project leading consultant and a presenter as well. So with that, I'll turn it over to today's presenters, or give a quick introduction before turning it over to Laura. So as I said, Laura is a project lead for the entire PMHCA program project, as well as one of our wonderful presenters. We are also joined by Sarah Rosadini, a program administrator at NNCPAP, Petra Stein-Buchel, director of UCSF Child and Adolescent Psychiatry Portal, as well as Rebecca Goslin, director of clinical initiatives, Youth and Healthcare Alliance. All righty, and with that, I will turn it over to Laura.
Hello, and thank you, Michaela, so much for those introductions. It's great to be with you all today. We know that we have a diverse group of participants from all over the country today who are working in a range of settings, and we would love to get a snapshot of who's with us on today's webinar. So Michaela's going to bring up a poll, and please indicate which category best describes your professional role.
All right, we'll give it about 5-10 more seconds. All right. I'm going to share those results, so you should be able to see those on your screen. We have an overwhelming, or not overwhelming, but we have a majority of State Department of Health, Education, and Mental Health folks here today at 47%. And our second is other. Lastly, we have PMHCA program staff and SBHA staff. And then our very last, our school district, SBHA affiliate, and our funder national organization. All right, awesome. Thanks, Laura.
That's very helpful to see. And we are so excited to have both stakeholders from PMHCA programs and school-based health centers. So as you know, the subject of today's webinar is about these emerging partnerships between the entities of pediatric mental health care access programs and school-based health centers. While we don't yet have a set of formal guidelines or best practices to share with you, what we do have today is some critical lessons from the field that we feel will be highly helpful in guiding these partnerships. In our short time together, we will today be highlighting the potential benefits of PMHCA and SBHC collaboration. We'll be describing the types of collaboration that's already taking place in states. We'll be sharing some key lessons from states that are already collaborating. And finally, we will be describing how two states, California and Colorado, are each approaching this unique kind of partnership. So why are PMHCAs expanding into school settings? For about a decade, our country has faced a growing children's mental health crisis, which we know has been exacerbated by the pandemic and has led to a nationwide workforce shortage of child psychiatrists. PMHCA programs are were developed and have played an important role in mitigating this crisis and building mental health capacity of pediatric care providers, pediatric PCPs. Meanwhile, children and adolescents are showing up to school with untreated mental health issues. They are being identified for, and in fact, they are now starting to receive mental health services in schools and have been for some time. Therefore, expanding services into school settings, and in particular to an established model of care, such as a school-based health center, is really a next logical step for PMHCA programs. So in the fall of 2022, next slide, please, HRSA recognized this opportunity and this next step and funded the School-Based Health Alliance to support this expansion into schools and to school health centers. So that we, as the School-Based Health Alliance, developed a set of technical assistance activities that included facilitating state-level partnerships, holding networking and coaching calls with PMHCA programs, hosting a learning community in which these programs came together to share their successes and their challenges related to this type of collaboration, and finally developing tools, resources, and webinars for both PMHCAs and school-based health centers, including today's webinar. So our ultimate goal with all of these technical assistance activities was to advance this model and to further increase access to mental health care for children and adolescents. We did this with the help of several organizations that joined us, and these include the National Network of Child Psychiatry Access Programs, which Sarah is representing today, the National Center for School Mental Health, and the Center for Adolescent Health and the Law. So next slide, please. So additionally, later in the project, we formed an advisory group consisting of these leaders, two of whom you'll be hearing from in a few moments, who are already leading this work in their states. In fact, the content that we're introducing today would not be possible without their collaboration, their commitment, and their ability to come together and share their expertise and their innovation around these partnerships. They also played a critical role in contributing to a document with the same name or similar name as today's title, PMHCA SBHC Collaboration, Lessons and Insights from the Field. And we will be sharing that publicly within the next few weeks. So given that there's been no roadmap for this kind of collaboration, we developed an iterative process of collecting and documenting information and data to better understand how these partnerships are built, what they look like, and perhaps most importantly, how they differ from collaboration with traditional pediatric primary care practices in the community. So you can see here that we started by collaborating and meeting with individual PMHCAs and learning about what they're doing. We provided outreach to our school-based health center state partners to understand what they knew about the PMHCAs. In many cases, they were still unaware of them. These SBHA affiliates and state program offices play a critical role with school health centers in their states by providing technical assistance, advocacy, in some cases, funding and certification for school health centers. We also invited PMHCA programs to come together in a learning community to share their experiences. We created a tool to collect data on the engagement with school health centers through the learning community. And finally, we brought together our group of champions. Early in this process, we discovered PMHCA programs were in many different phases of collaboration. Some had very little knowledge of school-based health centers. Others were beginning to make inroads with school health centers, while others had been collaborating with school health centers from the start. At many points over this project, we asked some of you and as many PMHCAs as we could, what they were, where they were in their journey in terms of collaborating with school health centers. So we don't want to miss an opportunity to do that again. And today we want to expand this question to school-based health centers as well. We want to know where you fall along the spectrum of collaboration. So the framework we're using is the stages of change model. And this is helpful to see where along the spectrum and where these collaborations have the potential to go. So if you could indicate where you fall, have you not yet considered collaboration? Are you in the pre-contemplation stage? Do you understand the benefits and you're exploring collaboration? Are you meeting with stakeholders and preparing for collaboration? Are you actively engaged in collaboration? Or are you already at the point where you are reflecting on your process, you're reviewing data and discussing ways to improve your collaboration? So we'll give you a moment to complete this poll.
All right, and we'll close it out in about 5 seconds. Let a few more folks get in there. All righty. Should be able to see the poll results on your screen. Looks like our winner. Go ahead, Laura.
Yes, our winner is actively engaged in collaboration. And this represents very much what we've seen all throughout the project, that we are communicating with PMHCAs who are very early in the process, and others are actively engaging. And it's been because of those in so many different roles that the lessons we're learning are so rich. And we'll be talking a little bit later about these various stages of collaboration. So hopefully we will meet the needs of all those who are on the call. So thank you so much for that information. It's really helpful to see. And we hope that you will inch along further in the stage of change process after today's call. What we know in order to move this along is that PMHCAs and SBHCs really need to understand one another. And so with that, I'm going to turn this to Sarah, who can give us some background on PMHCAs since she's so deeply rooted in that world.
Thank
Sarah.
you, Laura. Hi, everyone. I'm Sarah with the National Network of Child Psychiatry Access Programs. And before we jump in and talk about this amazing collaboration that's happening with PMHCAs and SBHCs, I did just want to make sure we're all on the same page. And if you're not already familiar, but it seems like from that poll, we have active contributors already. So we have a well-informed crowd. But the history of pediatric mental health care access programs, the model is not new. As you can see, it has spanned across some time, almost 20 years now. But it really has picked up speed in the last, I would say 5 to 8 years with federal funding. And that began in 2018 and with the most recent bipartisan Saber Communities Act, which was enacted in 2022. And that provided an additional $80 million for 48 programs. 49 programs received one-year expansion awards, and 3 national organizations, as Laura mentioned, including the School-Based Health Alliance, were awarded those one-year expansion awards as well to support the programs in their new expansion categories. And many chose to expand into schools or school-based health centers. So this is kind of setting the scene for these programs are really at various stages. And I think that's helpful to keep in mind when we talk about the different ranges of collaboration. Next slide. So what is a PMHCA program? They are state level programs developed in response to the children's mental health in crisis and the shortage of child psychiatrists. We all know there will never be enough psychiatrists to satisfy the need that there is out there. And this is a really effective model in really building the capacity of primary care providers to really treat and be the front line for their patients. So really it builds their capacity to assess, to screen, and to treat mild to moderate mental health disorders in the child's primary care practice and their medical home. Most of these programs consist of small teams, interdisciplinary in nature, including child psychiatrists, often social workers, care coordinators, program managers, and so forth. But really the main services of the model, the core principles, it's founded in teleconsultation. So really being able to pick up the phone, that primary care provider in their office, to call the statewide line and speak to a child and adolescent psychiatrist and get that, one-on-one conversation, peer-to-peer feedback, and help throughout a case. Another is the training and education to providers, and that's either through ECHOs, web-based trainings, toolkits, different material development, really spreading the knowledge more widely. And then resource and referral, connecting families who are in most need of those services to the right care in their communities. So these programs are really at different stages, but many of them have really taken these three core principles and kind of run with them and adapted it in their own ways that meet their own needs. I'll pass it back to Laura.
Thank you, Sarah. So we know there are folks on today's call that still may be less familiar with school-based health centers. So a quick overview of school-based health center model. School-based health centers are part of a broader category of school-based healthcare that refers to any health-related service provided in or near a school building through partnerships with community health providers. These services are offered not to duplicate, but to complement what's already available in a school, and they are provided in coordination and collaboration with the relevant school staff. School-based health centers are the most comprehensive type of school-based healthcare and have several unique characteristics that set them apart from traditional primary care offices in the community. And they offer primary care services as well as mental health, oral health, and vision, in addition to other services. So we found that there's some unique characteristics of school-based health centers that PMHCAs find particularly helpful to understand before they think about how they're going to adapt their services to this new setting. The hours of operations to begin with are relevant, as hours can fluctuate based on school day or school calendar. It's important to know that school health centers are operated by external organizations, most frequently by FQHCs, but sometimes by hospitals or other nonprofit organizations, local health departments, and in rare instances, school districts. There are full-time providers and employees in the school health centers, yet often the providers themselves have to divide their time between other school health centers or community sites. While they all have a primary care provider, the team may include a range of other roles, including medical assistants, social workers, therapists, school nurses. Information sharing in school health centers is, of course, driven by the federal law of HIPAA. However, because they collaborate so closely with school staff, there's a need to understand and navigate the federal law that dictates sharing student information, which is FERPA. And next and last, most school health centers offer mental health services. And in fact, in the School-Based Health Alliance's recent census report, 3 out of 4 school health centers reported being staffed by both primary care provider and a behavioral health provider. So true integrated care. And some school health centers, the centers are able to serve non-students as well, such as school staff, family members, and those in the surrounding community. So this is just sort of a snapshot of the components of school health centers. But now what I really want to focus on is where there's synergy between the two models. So we know that PMHCA programs and school-based health centers share some key goals. These include providing access to mental health care, delivering high quality care, and achieving financial sustainability. Their systems and structures, including how they use technology and data, how they track referrals, how they coordinate services, are very similar. And their staffing is similar in that they use prescribers and they rely on that integrated model of care that I just spoke about. Yet where the fit is perhaps most important is that by offering these services in schools where students are spending most of their days and most of their time and being located in under-resourced communities, school health centers already have the ability to overcome significant barriers to mental health services, such as transportation, location, income, but they can't do it alone. So by bringing PMHCAs together with school health centers, they can achieve health equity and ensure that students who need the care most can access high quality mental health services. Another area of fit or even serendipity is that in this moment in time, both of these movements are rapidly growing and they span across almost every state in the United States. And therefore, there's really a unique opportunity at this point in time to bring them together. And we're so honored to have been involved in helping to further along this model, this shared model. In the next slide, you can see the result of this recent growth. This graphic shows the overlap between PMHCA programs, School-Based Health Alliance affiliates, School-Based Health Center state programs in various states. While these state partners can certainly play a critical role in connecting the PMHCs to school-based health centers, they are not a prerequisite for partnerships. I really want to emphasize that point. In fact, we know of several states that have made significant and very exciting inroads with school-based health centers without these same partners. So I'm going to turn this over in a moment to start to really explore what collaboration looks like between PMHCAs and school-based health centers. But I want to first invite you in the chat to answer a question, which is, what does your collaboration look like? And what has motivated you to collaborate between the PMHCA and school-based health centers? So regardless of your affiliation, what do you see as being a facilitator of this collaboration or a motivator of this collaboration? So if you could just share that in the chat, we'd love to see that. And I'm going to turn this over to Sarah.
Thank you, Laura. We'll let those come through the chat. All right, and Michaela, if you want to go to the next slide, I'll make sure we keep going, but feel free to keep adding comments in. I'd love to hear your responses. So as Laura mentioned, one of the parts of this project was the engagement tool that was sent out to members of the learning community. And they completed the engagement tool. It's around 17 programs who did so. You'll see the little map in the corner showing which ones. And they really did complete the survey to really assess where they currently are. Often those questions, pre-contemplation, contemplation, what collaborating efforts they were doing. And we really did find that most recognize the importance of providing mental health services in school settings and recognize the benefits of partnering with school-based health centers. Fewer of them had an understanding of how school-based health centers are structured to provide mental health services. And it's important this tool was the audience who took the tool were mostly PMHCA programs. So it's from their perspective. Next slide. All right. And while it was not necessary to be collaborating to complete the survey, the data showed us that of those who completed it were currently collaborating in some way with school-based health centers. And then next, we learned that about half are currently consulting and providing resources and referrals to school-based health centers. And fewer of them are providing training and education specifically to school-based health centers, but most are in that planning process as well. And then this really shows us the different ranges of collaboration right now between PMHCA programs and school-based health centers. It's really reflective of where they are in the process. As you'll see with the larger upcoming lessons from the field document, really the extent and the intensity of any engagement really does vary as expected with where a program is at in the phases of collaboration. So really just to spotlight some of the examples, some programs tabled at conferences had presentations to school-based health centers. Some offered training specific to their learning needs. So really asked a group of school-based health centers, what do you want to learn more about? What can we offer you? And come in trying to understand what their needs are. And then as well as advocacy efforts at the state level to break down those silos and advance some shared goals. So we'll see in the parentheses some states who are participating in those activities. Please note that this list is not, all encompassing. So I'm sure there's many that we've left off of it, but this is to give you a little picture of what's out there. And really, what we took away, some key lessons learned from this collaboration is really the true uniqueness of school-based health centers. And it's really important to ask those questions, gather some data to understand really the overall landscape of the school-based health centers across a state. It varies very differently. Understanding those unique needs, those resources, what their interests might be, their capacity and readiness for integrated care as well. And as with everything, we say relationships is truly at the center, and taking that extra time to build, to cultivate relationships directly with school-based health centers really helps in the long run. And approaching them with some cultural curiosity, some humility and responsiveness, and coming in as like another peer, not as an outside expert, none of that top down, but really coming from the bottom up, saying, how can we help you? What are your needs? And understanding from them. And then as well as partnerships, consider who's involved with school-based health centers, and might be sponsoring organizations, it might be state affiliates, really getting partners together, and understanding what the needs and expectations are regarding those collaborations. So setting those feasible goals and following up with them. And then being intentional about promoting those partnerships, whether that's on websites, presentations, allowing each other to present at each other's conferences, and really expanding each other's networks. And then within anything, working in small stages and having that long-term vision. It's hard sometimes to do both at the same time, but really reflecting on a PMHCA goals and capacity to expand before engaging in services. Using those interdisciplinary teams, starting small and going slow, and making those strategic choices, as well as being really thoughtful about those program improvements that you can make along the way. And then with anything like this, thinking about sustainability from the beginning. How can we, begin to offer these services, but then how can we sustain them in the community and not start something and not be able to finish it? So something we're all keeping in mind, and I'm excited for you to hear more about it from our presenters, as well as in our lessons from the field document. And this is a lovely sneak peek of one of the graphics in the upcoming document, really showing that the steps to engaging school-based health centers are really iterative in nature and are often really reinforced by each other. We found that PMHCAs were often, for lack of a better term, walking and chewing gum at the same time. They're doing many things at once. And these core activities were being monitored, improved, and evaluated throughout the process. It was not linear by any means. And thus the goal of these engagement efforts was to eventually implement the range of PMHCA services in a school-based health center setting. So now I would like to take some time and pass it off to a presenter today, Dr. Petra Steinbuckle. She's going to share her experience with the UCFF CAP program.
Can folks hear me okay? Okay, great. Please let me know because I've had a little challenge with my audio, but I just wanted to invite you to walk on our journey that started in 2020 with developing the school-based consultation programming. Next slide. Thank you for the feedback. But there's some feedback in the background. Let me see if I can adjust that. So this is a little bit of our timeline in terms of our program development. We started with a donation in 2018 that got us going, and then we started with site visits to McCap and to PAL. And then we launched in September of 2019, which ended up being really fortuitous because it was just a few months before the pandemic. And then after that, we were able to secure some state funding through the California Department of Healthcare Services. And then with that, apply for HRSA funding. And one of our key goals in that was to include a school-based pilot that would hopefully align with some of the statewide funding that was coming through at the time as part of the Child Youth Behavioral Health Initiative in California, which is a broader, actually $4.7 billion effort aimed at expanding mental health for youth ages 0 to 25. And then, of course, we've been able to increase these efforts through the HRSA supplementation. Next slide. This is just a little overview of where we are. So we have several sites within our UCSF healthcare system. You can see here that we've got Site 1, which is Benioff Children's Oakland, which is where I've just done most of my clinical care over the past 15 years. And then we have San Francisco General Hospital in the city, and then also the UCSF Children's Hospital Network that's in the number 3 spot right there. Within Oakland, there are actually 4 federally qualified health centers that have been in existence for over 15 years. And 2 of those are located at 2 high school campuses that are in medically underserved and physical health underserved areas, and have been doing some version of integrated care for a really long time. And these are 2 sites where I actually was the psychiatrist in the way that Laura was describing, where it's, you know, part-time, a few days a month, but really got to be kind of embedded as part of the team, and as part of the medical as well as the mental health care team, and learn a lot about the culture of school-based health centers and the schools. In the middle here, we have a little bit of an overview of our Oakland district and schools. Just to get a snapshot, there are several school-based health centers throughout this, the Alameda, East Bay, Oakland area. And then this is just a brief snapshot of our current programming. We've got now 265 practices enrolled, including about 25 school-based health centers. We've been enrolling school-based health centers kind of from the outset, and did not develop specific kind of engagement for SBHCs, but we started to develop that a little bit later. Next slide. So this is just a snapshot of our 2 high school-based sites that are FQHCs and on the site of school campuses. These are definitely really special places, and often a place of refuge for the youth who come here, and a lot of youth who may not otherwise access medical care or mental health care. This is a snapshot of our team. I will say that, you know, some of these areas are quite rough, and one of the 2 sites actually has had a number of lockdowns because of shootings either on the high school campus or in the area. So this is a team that experiences a lot of vicarious trauma, and also by necessity, and also because of who they are, works very closely and very well together. Next slide. So because of all of this, we, you know, we felt like we had a lot of experience already. We had been invited by a donor to really address mental health care needs of teachers in a school that her daughter was actually a teacher and her granddaughter was a student. And this really, you know, brought to light the incredible need that the pandemic had brought, and that there was a really important focus on well-being and being able to teach basic skills that were often, you know, not necessarily available to teachers. And this is just an adaptation of this older Bronfenbrenner systems theory, where, you know, you have to think about the whole context, from, you know, the individual to the family, community, and also what is happening kind of in the bigger picture. And there was so much vicarious trauma during this time. So when we tried to launch in 2021, with, you know, kind of build it and they will come, people started, you know, going back to school in person for the first time. We just kind of said, we're here and we want to consult with you. And honestly, people said, you know what, we are so burned. We're still kind of being redeployed to, you know, to do COVID vaccines or to do dental visits, and, you know, being at different locations. And the school-based health center staff in the Oakland area that we had enlisted and tried to partner with said we cannot manage implementing one more thing. Next slide. So this brought us back to doing a needs assessment, and, you know, really trying to understand what are the needs from the providers, the clinicians, and the school staff's perspective on what are the needs. And as you can see, the, you know, students' social and emotional well-being needs were the greatest, as well as physical health and safety. What's interesting is that my own social and emotional well-being, while still rated highly, was kind of the lowest of these. But, you know, people were feeling incredibly stressed, had been experiencing so much constant change and lack of certainty. And so we just decided to start with helping folks put the oxygen mask on themselves first. Next slide. This is a kind of snapshot. There are many diagrams for human-centered design, but felt like this one really captured best what we were trying to do. This is an approach that we used for our overall CAP implementation and design process, starting with understanding the needs of the stakeholders and the end users, and then being able to define what the problems and needs are, and being able to do some rapid ideation and prototyping and testing. And then of course, coming back full circle in continual process improvement kind of cycles to figure out what are the needs, but having, the user needs, the end users, and also how does that play out in the context of systems, putting that at the center. And some of these things were, really requiring a lot of empathy, a lot of optimism and pushing forward. And then I think this one about embracing ambiguity is really key because, there weren't kind of clear signals. Yes, we want you to do this. People really didn't know how to define what they needed. So we needed to kind of ask, but also kind of push and lead from behind a little bit. Next slide. This just underscores that, we tried to think about our teams in different ways. So our internal SBHC teams that we were partnering with, as well as our internal team, who is doing the work, how is that being done? We had a really natural champion who's the director of school-based services for Children's Oakland and is now for the entire UCSF system of care. And she's had long-standing relationships and partnerships with a lot of the different sites and the local educational agencies. And again, this underscores the point about keeping relationships at the center, and then also being able to connect with and try to be curious with the teams that you're integrating into. Next step, next slide. We also were able to tap into existing relationships and deepen these with the California School-Based Health Alliance. And this is, they have a lot of really nice information on their website. I'll put the link in the chat, but basically, they were able to disseminate information about CAP, including trainings, and being able to support the work and list them as our partners. Next step. Next slide. And then in addition to our human-centered design framework, we wanted to look at what were the things that are easy to do, what are the high needs and low resources, and then where are the areas that we can really make a difference. And so we really conceptualized this as being able to do those prototyping and rapid testing with our local partners who were very willing and who knew also to be able to give us, dedicated feedback. And then what are the things that we can take in a broader scale to school-based health centers where people don't really know us, for example, Fresno and Humboldt. So we kind of stratified it into these 3 different groups, and with the easier lifts being Project Echo, and also some trainings that we could do via webinars. Next slide. So this is one snapshot of one of our Echo streams right now. And this is some of the feedback that we got during a specific Echo on suicide assessment, where we had about 140 attendees from really all over the state. And this is some of the feedback that we received, and also a snapshot of who participated. Next slide. This is this year's Project Echo series that is available to folks, and we do have participants who have signed up from across the state. One is really focused on what are evidence-based therapeutic skills and communication pearls, and these are meant to be for school-based health centers, as well as primary care providers who are wanting to learn a little bit about how to do, brief psychotherapeutic interventions within the 5 or 10 or 15 minutes that they have. And then we're continuing our school-based Echo with topics based on input from last year's group. Next slide. This is something I just want to brag about it just a little bit in terms of changes in practice briefly, that we did this system-wide webinar and training on addressing and assessing ADHD and trauma. And it was something that had been asked for by the school-based health centers as a really key priority. We got good feedback. There was nothing extraordinary though about the webinar in and of itself. And then 16 months later, when we met with this group again, they shared we have implemented this as a screening and treatment in all of our 10 different sites with tools in each exam room for doing this and workflow changes. And this was just so gratifying to hear that, one training helped to demystify some of the misunderstandings about it and wanted to avoid it. Next slide. So key takeaways consistent with what Sarah had talked about, that, so we're being curious about what are the unique needs and to prioritize relationships, collaborations, and partnerships. And again, to take a long view because you never know what might come out of it.
Thank you, Petra. Next, we're going to pass it off to Rebecca Goslin. She's with the Youth Healthcare Alliance, and she'll share about her work in Colorado.
Good afternoon, everyone. I am bringing a different perspective for what this looks like as far as being a state affiliate and working with PMHCAs and school-based health centers. So I am with Youth Healthcare Alliance. We are the Colorado State affiliate, formerly known as Colorado Association for School-Based Healthcare. We are an extremely small team, and I mention that because I think it's one of the things that makes us a really helpful player in this work. As part of our work, we build and maintain really strong personal relationships with school-based health center staff, and that puts us in a great position to do outreach and communicate one-on-one and really have a pulse not only on what's needed, but also how to connect different school-based health centers to one another. And so as that, I'd say our primary role in this work has been a connector. And that has been on several levels that I'll speak to more. And within that connection, we also have become an advocate. So really being able to understand and take a deep dive into what a PMHCA is in our state, how school-based health centers can work with it, and why it makes sense has really been central to this work. And I've learned a lot about that by being an advisory committee member for Colorado's PMHCA. Next slide. And this slide I really put together just to illustrate a bit of the complexity and the variety of organizations and different levels of state involvement and other involvement with PMHCA. So this is what it looks like in Colorado. Our PMHCA is COPCAP, and you can see that there are a lot of moving parts. One of the great things about being a part of this web is that there's a lot of connection. And so being part of the advisory committee, I am able not only to know what's going on with COPCAP, I'm able to learn from other state partners, and they're able to understand school-based health centers and where those fit into the mix. Next slide. And so as an active participant on the COPCAP advisory committee, I've really learned what it means. I'll be the first to say when I was invited to join this committee, I had no idea what I was walking into. I was not familiar with what a PMHCA was. I certainly didn't know why it mattered for school-based health centers. And so by being open to the opportunity, and I really credit COPCAP for inviting the state affiliate to the table, I was able to learn. And because I have that space and capacity as a state affiliate, I could then take that information, and when I heard the need, I could share it out with our network. And so that collaboration and outreach has been a really big part of what we do. Some of it has been general to everybody. Some of it has been in response to specific needs that I hear from specific clinics. And another wonderful aspect has been really building a relationship with COPCAP themselves. A great example of this is a bill for one-time emergency funding that came through. Both COPCAP and the state school-based health center program received one-time funding, and we were both able to be advocates and supporters for one another to get that funding in place. Another aspect of this work has been how we communicate to school-based health centers about what PMHCAs are. And so we've been able to use our existing platforms to get that message out. For us, that is hosting a lunch and learn, using our Basecamp to promote resources, and COPCAP is wonderful about sharing those so that we make sure they get out and they know the audience they're sharing with. We invited them to present at our conference, and it was one of the best received sessions at our conference in 2023. And then we've done individual outreach. So at the end of most of our advisory meetings, and sometimes just outreach to me personally, I'll learn about school-based health centers that are using COPCAP resources, but haven't enrolled in the program. And I'm able to make that connection, and they maybe know my name and my email and respond, and then I'm able to hand them off to COPCAP to follow through. And then a really neat piece of this work has been helping school-based health centers who benefited from COPCAP services connect to those who could benefit. And I think we've seen a lot of really great success when providers talk to other providers. Next slide. So I wanted to celebrate some of those successes with this slide, and also say that I use this in my messaging to school-based health centers, because a lot of times what I get is, how can I get a child psychiatrist connected with my school-based health center? And the reality that you can see from the map on this is that there just aren't many to go around. And so I don't have the answer people want, and I'm able to offer them something very helpful. And that has been a huge success for, especially if you look at this map, a lot of Colorado is extremely rural and even frontier in nature. And we have extreme shortages of child adolescent psychiatrists. So to be able to say, I can't connect your students directly, but I can help you support them and you can get that consultation, has been transformational for some of these school-based health centers. Next slide. And on these next two, there are some real testaments to how this has impacted our school-based health centers. Both of these are from practices that are on the rural western slope in Colorado. And it has been an absolute gift for them to be able to get the support that they need to support their clients. So this one is, I've participated in the COPCAP Echo Series annual conference and community of practice opportunities over the past 2+ years. I have found the psychiatrists and COPCAP team to be incredibly helpful, knowledgeable, and supportive. I've enjoyed learning from various providers on their team and recommend their services and program to colleagues regularly. I have been able to use their call line to get patient-specific consultation numerous times. This has been a benefit to my practice and to my patients. With increasing awareness of mental health concerns in our patients, services such as those provided by COPCAP improve the efficiency and quality of primary care services in Colorado. And then we have another testament to the power of this work. COPCAP's response time is quick. We have worked with providers at COPCAP on numerous occasions in diagnosing conditions such as bipolar, eating disorders, medication adherence, medication management, and many other things. It is a simple workflow to reach a provider. They generally call the NP cell phone directly within a half-hour window and have been invaluable. They offer suggestions, directions, recommendations, and it's a very successful program. And so I think, next slide, this leads into some of our takeaways, which is it is multiple levels of the PMHC program, the consultation as well as the education, that is a huge benefit to school-based health centers who are seeing so much behavioral health as a need among their patients. When I go and visit school-based health centers now, and I ask the primary care providers what they're seeing, almost everyone says that behavioral health is the #1 concern coming in their door. And so the alignment between what's needed and what's out there is not always what people want to hear. And at the same time, when they give it a try, they find it really does meet a need. That peer-to-peer sharing may be the most powerful aspect that we have seen. When we can have providers share their experience, it really helps other providers see the benefit. And that this takes time. You have to explain the value. School-based health centers, like all primary care settings, are very busy. And so that demonstrated value over time is really important, which is why we need to have repetition, we need to build relationships, follow up. And then there's that need to connect people at the state level. And that's where we can see this greater advocacy and partnership happen. So for me, it's been a very powerful experience to be part of really what feels to be a comprehensive network supporting our providers to support our youth.
Thank you, Rebecca. You can go to that other slide, Michaela. So this is just a call out to school-based health centers and school-based health center leaders. A lot of this work this year has been focused on educating the PMHCs about school health centers and walking them through the process and connecting them to school-based health centers. But as school-based health centers, you all on the call who identify as school-based health center leaders, and I hope anyone who's affiliated do see yourselves that way. There are so many roles that you can play as well. You can be navigators, you can monitor the work, you can be ambassadors, you can be connectors. So we just want to encourage all of you as well to take an active part in seeking out your PMHCA collaborations. So the next slide is just a nice summary of what we heard today from two very different PMHCA or two PMHCA programs that are in very different stages. And what we heard is that there are many benefits to partnership, but the collaboration absolutely has to be adapted to meet state needs. So really getting a sense of what that fit is, both by examining the capacity of the PMHCA and understanding the needs of the school-based health centers. And that will really help to engage the school health centers by understanding what their needs are and involving early a diverse group of stakeholders, particularly any school-based health centers in the process. And I love that Colorado did that and included Rebecca on their advisory group. By engaging early and engaging the right people, these partnerships will be sustainable. They will lead to cross-sector collaboration, which we know is so hard at the state level, and can even lead to advocacy beyond these particular partnerships. And at the root of all of these steps is relationships. I think we've underscored that a lot today. So where do we go from here? We've got some thoughts on some future directions, and we'd love to hear from you as well. So we believe that there is a real role for PMHCA programs and school health centers to play together in promoting and educating one another about their models and in considering expanding their services to provider types beyond PCPs, particularly mental health providers, and in this case, in school health centers, developing and sharing implementation models, documenting these models, exploring integrated data practices, and sharing successes, challenges, and impact along the way. They cannot, and you cannot do this alone. Certainly is a large role for national partners as well. The national partners can create learning spaces for the exchange and sharing of ideas, of best practices, of innovation. It would be helpful to have aligned funding for school-based health and school-based mental health initiatives. National needs assessments in these areas is really needed to understand where the needs are, where the resources are, where there's capacity, and where there's some data demonstrated impact. And finally, to offer technical assistance and open access resources for all to be able to access, such as toolkits. So with that, if you could put in the chat some other directions you'd like to see this work going, or especially to those of you who have not yet started and embarked on this work, what would you need to do so? So please fill the chat with your thoughts on where you'd like to see this work go. And in the meantime, we will open it up to Q&A. See if you have any questions to our presenters or to Sarah or to me with this work. Yes, telehealth goes hand in hand, doesn't it, to the teleconsultation. Thank you, Heather, for underscoring that, particularly in these underserved communities. You can go to the next slide, Michaela. Still feel free to put your questions in the chat, and Michaela's going to administer a poll.
We have one question that came in. How does a state become an affiliate?
So I'm going to put a link in the chat for that. The School-Based Health Alliance does have a process and some materials to describe what that entails. And so I will include that in the chat. That is also in our materials. And in fact, if you can forward the slides, Michaela, I would like to share some resources that we have for you. So this is the document that we've referenced that the advisory group helped contribute to, and really the culmination of all of the work and the learnings that we had over the course of this last year. And we're very excited about this document. It includes more on those specific steps to engage PMHCAs, different modifications and innovation about working with school-based health centers, implications for evaluation, quality improvement, and data. We spotlight not only California and Colorado, but several other states in these documents. And we've got some resources, including how to start a School-Based Health Alliance affiliate at the end of these documents as well, and spell out more of the future directions. Next slide. We will be having a landing page at the School-Based Alliance website, or on the website, that includes a number of other materials that were developed during this project. And I just want to call out that there are some documents that talk about expansion to the school setting at large, as well as some a document that helps sort of describe those two federal laws that I referenced earlier, HIPAA and FERPA, that are important for school health centers to understand, as well as any PMHCA supporting them. And we've had a couple of webinars, and those recordings are available as well. Here are some general resources. This is a way to stay connected with the School-Based Health Alliance by subscribing to the biweekly digest. And finally, the next slide shows NNCPEP's base camp specifically for PMHCs that are interested in or already collaborating with school-based health centers. So please feel free to join that. This is our contact information. You're welcome to contact any one of us afterwards with some follow-up questions, or to contact the School-Based Health Alliance directly. I'm so grateful for this opportunity to share with you what we've learned about PMHCA and SBHC collaboration this year. Thank you so much for joining us in today's webinar.